Welcome to TEKNXS, a place where technology and finance lovers come to get inspired. In today's video, we will talk about a special topic about COVID-19 and children. The topic is COVID-19 genesis and its psychological impacts on children. Let's start. COVID-19 is inciting panic for several reasons. It's a new virus, meaning no one has immunity, and there is no vaccine. Its novelty implies that scientists aren't sure yet how it behaves. They are liable to change and recombine. They mainly infect human and non-human mammals and birds. The virus that caused COVID-19 is thought to have originated in bats, snakes, and humans. They drove minor infections similar to the common cold. At the same time, certain age groups may be less exposed to the health effects of COVID-19. The global pandemic affects everyone of all ages and all walks of life. Contrary to adults, children infected with a novel severe acute respiratory syndrome coronavirus, SARS-CoV-2, reportedly are having a milder illness, low morbidity, rare cases of infantile infection. It is young people who are most concerned about someone in their home becoming sick, according to Associated Press NORC Center for Public Affairs Research. It will most likely leave a significant mark on both adults and kids. COVID-19 has stumbled onto one of its greatest crises since World War II for the last few months. With over 2.62 million cases already and a death toll of more than 1.8 lakhs, it is expected that, like in adults, children having pre-existing illnesses like cystic fibrosis, severe asthma, congenital heart diseases, malnutrition, and obesity. Children from antenatal smokers are at heightened risk for the poor outcomes of infected with COVID-19. Healthcare staff and parents are generally worried about children. Historical experiences suggest that some viral infections are less severe among children. Various hypotheses have been put forward to explain the lesser severity of COVID-19 among children. 1. Healthier respiratory system. 2. Lesser outdoor activity. 3. Higher rates of respiratory viral co-infection. 4. Greater activity of thymus, including thymosin secretion. 5. Lesser prevalence of comorbidities. 6. Bacillus calmette-guerin (BCG) vaccination. 7. Progressive increase in serum angiotensin-converting enzyme. Therefore, there is a fair chance that as the children are having no to minimal symptoms of the disease, it is too early to commit to children having lesser susceptibility. Its short-term and long-lasting psychosocial impact is increasingly being recognized all over the globe. Psychosocial impact on children. Home quarantine imposes immediate psychosocial impact on children due to drastic changes in their lifestyle, physical activity, and mental excursions. Children who are being quarantined at institutions are the worst sufferers. Children's good well-being depends not only on nutritional and medical care, but also on proper parental companionship. This may cause everlasting psychiatric consequences, such as anxiety, psychosis, depression, delinquency, and even suicidal tendency. The experience from SARS-CoV and MERS-CoV suggests that the decision of school closures will not have similar effects. The transmission dynamics are different as compared with the influenza pandemic. For children, school is an educational hub and a home outside the home, plentiful free space. Schools offer a window of freedom, scope of interaction with fellows and seniors. Schools play an instructive role in promoting the importance of personal hygiene, physical activity, healthy food, and body habits. Even a short-term shutdown of educational institutions and home capacity for children is indeed troublesome. This closure affects children's physical and mental health. The routine habits of school-going, task-oriented education, peer group interactions, teacher-student relationship, and fellow pupils' feelings will occur with daily school. The complex interplay between psychosocial stress and pandemic-induced forced homestay. Lifestyle modifications will further worsen the effects on a children's overall health in a brutal cycle fashion. A school is also a place for nutritional support. Prolonged shutdown hits the notion of the right to education. Challenges and educational inequalities stem from it. The learning gap will widen between children from lower and higher income families during this institute closure. The accessibility of electronic gazettes, learning equipment, home conditions for studies among children becomes very difficult. Child abuse, dropout from formal education, and child labor could be potential socioeconomic consequences of the COVID-19 pandemic. Both direct and passive exposure of the children has bad effects. For example, psychological aggression, higher rates of psychosomatic and neuropsychiatric disorders, multiple substance abuse, and suicidal thoughts. The risk of sexual exploitation, teenage pregnancy, transactional sex, and similar consequences faced by children from Africa after the Ebola epidemic. Endangered girls had to undergo transactional sex to fulfill basic needs like food, drinking water, and shelter. COVID-19 has opened up avenues for more cyber crimes, and criminals are taking advantage of suppressed cybersecurity for this hour. Health and financial inequality takes center stage at risk of contracting and propagating COVID-19. Pandemic, followed by an economic downturn, will hurt the poor children the most. Millions of children living in detention facilities, immigrant camps, orphanages, or similar institutions lack liberty. These places will act as a fortified and enriched culture media for any pathogen like SARS-CoV-2. Nothing can be worse than the fact of these helpless children. Children with intellectual disabilities and problems like autistic spectrum disorder, attention deficit hyperactivity disorder, are at high risk of getting hurt by SARS-CoV-2. A strict nationwide lockdown makes it impossible for the ill children to visit their psychiatrists or counselors and interrupt the supply of regular psychotropic medication. Subjects who are already suffering from a severe mental disability should be dealt with extra care. Otherwise, there will be a potential for illness and a worsening of life quality. Many pupils depend entirely on school for primary health care. COVID-19, once-in-a-lifetime phenomenon, is not just a public health crisis, but a problem for human existence. It will carry a long-lasting impact on social, economic, behavioral, psychological consequences. Because of the current death toll, casualty from COVID-19 will create millions of orphans in the months to come. This disease is an excellent test for frontliners. Fear and guilt of contamination of the lethal virus to their little ones are taking a toll on them. But they're probably feeling proud of their heroic parents at some corner of their hearts. Before COVID-19, approximately 152 million of children were already engaged as child labor, and almost 50% of them are doing hazardous work. COVID-19 will only add numbers by several millions more to them. Children are already extra sensitive to emotional stress. History will redo itself once more, but will leave lessons for humanity and its future. Questions arise whether the existence of the human race is essential or merely coincidental. Society has to decide what kind of world they want for their children to live in. The answer, my friend, is blowing in the wind. Bob Dylan. Positive impacts. Not all impacts of the COVID-19 pandemic are entirely negative, however. The crisis may also accelerate and reinforce existing consumer trends. For example, while young people are already fluent in digital technology, virtual living has become an even more entrenched part of their lives during shutdowns. There will be an increase in online grocery delivery, music and video streaming, and virtual entertainment events. According to Lan Ha, the emphasis on technology and digital experiences is expected to continue even after the pandemic. Health and wellness is another trend to watch. Young consumers are known for embracing ethical and healthy lifestyles, but the COVID-19 pandemic will raise their awareness even more. Young people are expected to pursue fitness goals, cook more fresh food at home. They will seek products and services that support their mental health, such as meditation apps. Reviews. While temporary school closures resulting from health and other crises are not new, unfortunately, the global scale and speed of the current educational disruption is unparalleled and, if prolonged, can threaten the right of education, said Audrey Azoulay, Director General of UNESCO. Out of suffering have emerged the strongest souls. The most massive characters are seared with scars, wrote Lebanese-American poet Khalil Gibran. In his novel Kafka on the Shore, Haruki Murakami wrote, "When you come out of the storm, you won't be the same person who walked in. That's what this storm's all about." With the disruptive effects of COVID-19, including social distancing, currently dominating our daily lives, it is essential that we check on each other, call and video chat, and are mindful of and sensitive to the unique mental health needs we care for. Our anxiety and fears should be acknowledged and not be ignored, but better understood and addressed by individuals, communities, and governments. Dr. Hans Klug noted. Conclusion. The frontline physicians must be made aware of the psychosocial need of quarantined children. Hospital authorities need to make arrangements so that children can communicate with parents via audio-visual devices. The government should make operational strategies to provide mental health care for quarantined children. To mitigate the psychosocial ill effects of COVID-19, targeted interventions can be proposed. Parents, psychologists, social workers, hospital authorities, government, and non-government organizations have important roles to make the mission successful. Parents need to monitor a child's performance, behavior, and self-discipline skills. Friendly interaction and communication between parents and children may help to smooth their pandemic-related anxieties and other physical and mental issues. Schools' authorities should plan restyling academic calendars and test schedules to enfeeble the effects of school closure. Social sites should be more cautious about censoring content to impede online sexual exploitation. Do you think children of our society can overcome the psychological effects of COVID-19? Express your thoughts in the comments. For more updates, make sure to subscribe and turn bell notification on.